Jen, welcome. All right, everyone. Geneva, is it okay if I get started?
Yep, so we're live now.
Okay, great. Welcome, everyone. Thank you for joining us tonight. First, I'd like to start by talking a little bit about the Interfaith Center at Miami University. The Interfaith Center at Miami University is a 501c3 nonprofit organization that seeks to unify people through relationship building, dialogue, and social action. This workshop is made possible by a generous grant from the McCullough Hyde Foundation and the Interfaith Center's Building Healthy Communities Strategies and Resources for Faith Communities project. And we'd like to thank those organizations, the McCullough Hyde Foundation, for their support. We'll start off just to give you an overview of what we'll be doing today. I'll start by introducing our panelists. And we're going to have our presentations in three general sections. First, we're going to have a little presentation about some of the stats, overview of heart health, heart disease in women. Then we're going to share some stories about how we've each been impacted by heart disease in our families and what we're doing to try and combat that legacy. And then we'll have another presentation on healthy habits. So first, let me just open up one of my slides here. I'm going to introduce several people. And if you can just sort of wave or something as I introduce you. First, I'll start with Takia Howard. Takia is actually the reason why we're here today. Takia is the one who approached me about possibly partnering with her to do an event in support of Go Red for Women. So Takia Howard is the director for programming at Miami University's Office for Transformational and Inclusive Excellence. And this year she's serving as a nominee for the American Heart Association Woman of Impact for the Go Red for Women campaign. And as part of this effort, she leads a team of 14 individuals, including 3 other members from our university here at Miami, to raise funds and awareness for this campaign. We also have Brianna McNeil, who is a family nurse practitioner at a federally qualified health center in Washington, D.C., with a strong focus on primary care. Brianna is dedicated to improving the health outcomes of underserved communities. As a provider with experience in managing chronic conditions and promoting preventive care, Brianna works to empower patients through education and personalized treatment plans. And I have to go to another slide for this. One moment, please. All right, Dr. Myron Gerson is Emeritus Professor at the Division of Cardiovascular Health and Disease at the University of Cincinnati College of Medicine. He's past interim director of the Division of Cardiology, has trained over 170 cardiologists at the University of Cincinnati's Medical Center. Past president of the American Society of Nuclear Cardiology, has over 124 peer-reviewed publications, has done past research and supported by grants from the National Institutes of Health and the American Society of Nuclear Cardiology, and has several other accolades to his name. So I want to thank you for joining us as well. We also have Dr. Yvette Harris, who is a professor of psychology at Miami University. She's a certified yoga instructor, and she is also the director at the Center for the Study and Support of Children and Families of the Incarcerated. She's done a lot of work with communities of color. And then finally, we have an artist who has joined us today, Maggie or Margarita Feinfrock, who will be drawing and taking notes and making art out of the conversation that we have today. So we have a really rich presentation planned. And if you happen to be a doodler or a drawer and you would like to just take a pen or a pencil and relax by making some images or drawing as we have this conversation, you are invited to do so at this time. So we will start with Brianna. And Brianna, give me a second. I'll pull your slide presentation up. And Brianna, you can just feel free to just let me know when you're ready to move forward to the next slide. Okay.
Okay.
Okay. Can you see this, Brianna?
Okay. And I apologize. Yeah, I can see it. You can just play it and then there we go. Okay, so I am sorry in advance. The font might be a little off on some of the slides, but I think it's still gonna be okay. So as mentioned earlier, I am Brianna McNeil. I am a nurse practitioner here in DC. I'm a family nurse practitioner, which means I see everything, but cardiovascular disease is a big part of what I do every day at work. So we'll start off with what is cardiovascular disease. You can go to the next slide.
Yes, I'm on the slide.
Okay. It's not showing up on our end. It's still on the initial first screen. There we go. Okay.
I think there's just a
So
delay.
cardiovascular, oh, gotcha. Okay. There we go. So cardiovascular disease is a group of disorders that affect the heart and the blood vessels. And it's actually the leading cause of death globally, including women. And so women often experience different or subtle symptoms compared to men, which is something that we will also go over a little bit later in the slides. There are a bunch of different cardiovascular diseases. So there is coronary artery disease, which is when there's a blockage or a narrowing in any of the heart vessels, and that can lead to heart attacks and high blood pressure, stroke as well. There's hypertension, which most people are familiar with. That is going to be just high blood pressure, which is also a major risk factor for heart attacks and strokes. There's heart failure, and that's just when the heart stops pumping blood efficiently. There's arrhythmias, and that's when there's an irregular heart rhythm. There's strokes, that's when there's a reduced blood supply to the brain, and then that's usually caused by a clot. And then there's also peripheral artery disease, and that's just when there's the narrowing of the arteries, typically in your legs, is what most people experience it with. You can go to the next slide. So the next slide is going to have just some generalized facts and information about cardiovascular disease that I found pretty interesting. And I think a lot of people don't realize that it affects so many people, and it actually affects a lot more women than we think. There we go. Okay. So cardiovascular disease is the leading cause of death in women. So when we think of cardiovascular disease and we think of heart attacks, strokes, a lot of people tend to think of men, but it is actually the leading cause of death among women. Among women 20 years and older, nearly 45% are living with some form of cardiovascular disease. There is cardiovascular disease is the leading cause of death among new moms, and it accounts for over 1/3 of maternal deaths. So that's also something that I'll talk about a little bit later, but having certain complications during pregnancy does put you at risk for having cardiovascular disease later in life. Going through menopause does not cause cardiovascular disease, but as you approach menopause, that does mark a point in a woman's life where there are those risk factors are accelerated. And then approximately 57% of stroke deaths are in women. Like I said earlier, a lot of the times when we hear stroke, heart attack, we think of men, but it actually is a large percentage of women who also experience these things. And most cardiac and stroke events can be prevented through education and lifestyle. So that's what we're here to do today. So this next slide just has a couple of things that I think is very helpful to know. And these are things that put you at risk for developing these things that lead to cardiovascular disease. So as I mentioned earlier, high blood pressure. I think everybody kind of knows a little bit about high blood pressure, but it's estimated that about 51 to 52% of high blood pressure deaths are in women. And then there's 57% of Black women who have high blood pressure, which is more than any other race or ethnicity. This means it's just really important, one, to know what your blood pressure is, also knowing what a normal blood pressure is, and then knowing if you have a history of hypertension, high blood pressure, that it's important to take your medications and also check your blood pressure daily and kind of know where you stand so that then if you notice any changes, you can talk to your healthcare provider about that. And a normal blood pressure is around 120 over 80, just so everybody knows. Unhealthy diet, obesity, and physical inactivity, those all kind of go hand in hand. With an unhealthy diet and obesity and physical inactivity, this puts you at risk for things like high cholesterol. And having high cholesterol is just an increased risk of plaque building up in your arteries, which then can cause a blockage, which can then cause things like a stroke or a heart attack. Diabetes is also another really big risk factor. So when people think of diabetes, they tend to think of, just, oh, my blood sugar is high and I just need to get that under control. But actually, women with diabetes are more likely to develop heart disease than men with diabetes. And it affects so many other systems in our body. And so when you have diabetes and it's not controlled, that can then cause issues with other blood vessels in our body, which can lead to high blood pressure and then stroke or heart attack. Smoking is another big risk factor. So women who smoke are more likely to develop cardiovascular disease than men who smoke. And then also, like I mentioned earlier, briefly, pregnancy complications. So high blood pressure and diabetes during pregnancy actually does increase your risk of having long-term complications such as high blood pressure and also diabetes later in life. You can go to the next one.
You should be able to see.
I see. Yep.
Okay.
So these are just some of the signs and symptoms to look for when it comes to a heart attack, because it does look different sometimes for women compared to men. So most common is chest pain, chest discomfort. But then there's other things that women tend to experience and men do not, which is also why a lot of the times it is missed in women. So there's pain or discomfort. You can have it in your arm. A lot of the times it's in the left arm. But also back and neck and jaw pain is also one that's a little bit more common for women versus in men. And then also a feeling of indigestion or stomach upset. And then shortness of breath, and also cold sweats, feeling nauseous, or even like lightheaded is another big one. And then these are things to look out for in regards to a stroke. So sudden numbness or weakness in your arm, your legs, in your face, what we call facial drooping. So one side kind of literally droops down, and it's typically one side. Sudden confusion, trouble speaking, understanding people, trouble with your vision. It can either be one eye, it can be both eyes. And then also trouble walking, feeling dizzy, losing your balance or coordination. And then also sudden severe headache with an unknown cause. Usually I tell people if you're having a severe headache, just doesn't go away with pain medication, that's usually a sign that something else could be going on. So what can you do to prevent these things? So healthy diet, healthy diet, healthy diet. I don't know how many times I can say that, but healthy diet. And also exercise. Those are two of the biggest things I think that people don't do or we neglect, especially when we're younger, because we think we're young, everything is fine. And then as we get older, it's hard to change those habits. So the sooner we start, the better. And it's never too late to change those habits. It just gets harder as we get older to come out of those ways. So healthy diet, exercise are the two biggest things. Also, just getting screened, just going to the doctor and saying, hey, I have this family history of this, this, and this. I want to make sure that my blood pressure is normal. Every time you go to the doctor, they're going to check your blood pressure. It's as simple as that. That is something, that we can also easily do and manage. There are tons of medications for high blood pressure, but you don't know if you have high blood pressure until you go get your blood pressure checked. And then also just medication compliance. That is a big thing that I see, and a big issue that I see in the community that I work with is people not wanting to take the medications, and feeling a kind of way about medications. And nobody wants to take a bunch of medications, but they are for the better. And also, like I said, just making sure that if you are on medication, you're taking the medications, but you're also checking your blood pressure to make sure that the medications are still working, because over time they can not work. Or if you're changing, things in your diet, you're working out less, things like that, that can cause the blood pressure medications to be a little less effective. So just making sure that when you're taking your medications, two, you're also checking your blood pressure consistently to make sure that there doesn't need to be any adjustments. And that's all I have for you guys.
We can share these resources as well with others after, because it looks like there are a lot of great resources here. So Brianna, thank you so much for sharing. Yes, nice job. And I wondered if people have questions as we go along, please don't hesitate to put them in the chat. I'm sure Brianna, any of our panelists who can answer them would be happy to answer them. So at this stage in the presentation, I see Samantha just unmuted. Samantha, do you have a question? Samantha McNeil? Okay, maybe not. Okay. I want to reintroduce Takia Howard, because I want you to share your story about why you decided to become active and to play a role as an advocate for this at this time.
Certainly. Good evening, everyone. And I want to again pause and thank Dr. Amber Franklin and Geneva for saying yes to me as I'm exploring ways to share this information as a nominee, yes, but also to share this vital information. So thank you. I really appreciate you taking a chance and really taking by the horn. So today, I guess I decided to take a stance because I am a daughter that's forever changed. About 3 years ago, I talked to my mother every day because I have a 45-minute drive to and from Oxford. So every day I talked to my mom like clockwork every day. And so like a normal day in July, I talked to her at 5 o'clock. She was preparing my now nephew's bedroom for birth, anticipating his birth. And so everything was normal. I said, I'll call you back, talk to you later, not a big deal. But the next call that I received from my dad actually changed the days as I would ever never know it before. And he said, well, your mother lost consciousness, right? And we're taking her to the hospital. Now, my dad is a wrestling coach. He has worked in places where he knows. I knew that he tried to revive her, and I knew how he sounded on the phone. I was like, oh, this is really serious. So nevertheless, by 9 o'clock that evening, we come to Dayton, and I found that my mother had passed away. We are an active family. I mean, as I learned more through this campaign of Go Rare for Women, maybe there were signs, but we didn't know. I didn't know. So it was a complete and utter shock. At 5 o'clock, it was regular, and at 9 o'clock, it was forever changed. And when we left the hospital and the next days following, we had more questions and answers, right? She was consistent. I was very active in her life as a daughter, making sure that she was getting her checkups and things like that. And so there was just no, well, she had a heart attack. And in my head, well, nobody just has a heart attack. I mean, she just left her doctor, earlier that week. And I was there with her at that appointment. And so it was literally nothing. She had a heart attack. And that's it. And so when I was invited or asked to be invited to be a nominee for Go Red for Women, I did pause. I said, wow, right? One, the intimidation of raising funds, but also who and what can I share? What can I share? And although that's my story, and as I talk to other women across the nation, there's a lot of similar stories. And what really shocked me and rocked me to my core as continue is one, American Heart Association has been around for 100 years, and only since the last 20 or so years have the world start looking at to women's health. And then we can go further, and the disparities with women of color and Black women is even worse, right? And the signs are somewhat different. And then another piece, working in higher education, it said there are like 85% or so women of color over the age of 20 and older has some form of heart disease. That is a lot of women who simply just don't know. And as Brianna had just shared, all those elements are present. And so that's why I fight. I think there are simple things that I didn't know about pregnancy that could impact, your heart disease or cardiovascular disease. And so that's why I fight. That is why I said yes to this Go Red for Women campaign. And again, the information that I learned and that I shared is something that I will always do. I will always be intentional in sharing information. I mean, it's something that's a tingle. Now I'm like, is there a tingle in my toe? I'm like, hey, somebody let me know, could this be it? Because we just look so drastically different than men's symptoms and how we respond and why we respond. It is so important to make this a part of our everyday conversation and to be active and do some of those things that Brianna has shared in terms of, exercise, be healthy, ask the question. Don't assume, if I'm going to talk about the Black community, a little soft, it's not going to fix it, right? Go to the doctor and ask the silly question. So be well. Be well.
Thank you for sharing the powerful story. And I'm wondering, for those of us who are on the call, if there's anyone whose life, directly or indirectly, someone close to you, a family member, a woman who has been impacted by heart disease, stroke, heart attack, coronary artery disease, can you just either raise your hand or just say me in the chat? I'm going to put the word me there. I think eventually we'll probably see that there are many people here who've in some way been impacted by this. I'll share my story a little bit, is that I come from a family that has a very deep history of heart disease and stroke. And so it's something I always grew up understanding. I'm a speech language pathologist by education and training, so I'm always very aware of how strokes impact lives of the people who suffer the strokes and their family members as well, and how common they are in different communities. But I remember my grandmother in the Caribbean, she died very suddenly of a heart attack at age 72. And it was really devastating for my mom. But one of the things for our whole family, but for my mom in particular, because of the way that she, when family members live far apart, she was at work when it happened. And my cousin was at home. He was a teenager at the time, and he had gotten the call from someone in the Caribbean, one of our family members, that my grandmother had passed away. And he called my father to go home and pick up my mom so that she would hear it from him, but she left work earlier than he expected. And when she came home, she just checked her messages on the phone, and it was through someone leaving a message saying, "I'm so sorry to hear about your mom's passing." Someone from Anguilla, from the Caribbean, leaving that message. That's how my mother found out that her mother had passed away suddenly of a heart attack. And I remember when we went to the Caribbean for her funeral and her celebration of life, there were people who were talking about what a giving person my grandmother was, but there was something that always stuck with me, is that people talked over and over again. They were really valorizing her, but they kept talking about how you would never know if she was suffering, that she went out of her way to do everything for everybody else, but that you would never know if she needed anything. You would never know if she needed help. And I just remember thinking, I admire my grandmother, and I love her. I don't know that that's a model that I want to replicate in my life. And I think for so many women, that's like we give and give and give and never let people know when we need something from them. And so for anyone on the panel, Dr. Harris or anybody, that kind of pattern of women not asking for the help we need, I mean, that's got to increase stress. Yeah, Dr. Harris, do you want to share?
No, I think it certainly does increase stress. As you're talking, Amber, I'm going, yeah. That is probably typical characteristics of women, some women who are in a direct caretaking role, women who are in a peripheral caretaking role. We tend to overcommit. And to the extent that we ignore our own health and well-being. So when I get to my part, I'll talk a little bit about the need to engage. And I know this is an overused word and it's probably lost its meaning, but we should shout it from the mountaintop, self-care. And I'll talk about my path to self-care, and that's through yoga.
Thank you. And thank you, Amelia, for sharing. Where in the Caribbean is your family from? If you can say something in the chat, or I'm curious to know. Okay.
Oh, we're Cuban.
Ah,
Yeah.
yeah,
Thank you so much for this. This is, I cannot stress how much education is needed to learn, how to break out. Thank you.
yeah. And it starts with things like this, and it starts with people talking and asking questions. Um, I feel very grateful that when I go to the doctor, my blood pressure is pretty normal, but I do have a blood pressure cuff for myself at home that I check. And how much of it is lifestyle that choices that I'm trying to put into place, and how much of it is genes, or time, I don't know. Joycelyn, do you have anything you'd like to share?
No, I was just agreeing because I feel like we put so much energy into like the things that we're doing, not necessarily how we're taking care of ourselves. And so kind of like flipping it a little.
Mhm. Yes. Um, so Dr. Gerson, do you want to share your slides now and maybe talk about lifestyle choices?
Sure.
Okay.
Okay. Well, thank you. Um, I'm going to talk about healthy lifestyle choices and prevention. I think it's very important to think about where do these recommendations come from that you see for the American Heart Association, for example. We're very fortunate in the field of cardiology because we have a very extensive literature of large randomized controlled studies. These are the most valuable types of studies to draw our conclusions from. And because a large proportion of the US population has or will have cardiovascular disease, recommendations like the recommendations from the National Institute of Health and the American Heart Association come from strong factual data.
That's good. She can see this.
Can you see my slides okay?
Oh, no, we don't see them yet. I wasn't sure if you were sharing
Oh,
yet.
I wonder
Go to share screen. Computer won't show.
Ah.
Find the slides on. No, okay. Let's put it on the share screen.
There we go. It's coming
You can
up.
see them now. Okay,
Yes, yes.
okay.
This is fine. Yep.
Okay. Let's see what you can get there. Okay.
So what has actually been the record of the scientific community on treating and prevention of heart disease, both in women and men? And you can see between 1950 and 2015 that there's been a fourfold decrease in coronary heart disease and heart attacks and a decrease in overall cardiovascular disease. So there's been a lot of success. And what does the success rest on? Largely, it's based on improved lifestyle and better medication, things like statins. And yet, cardiovascular disease is the #1 killer of women, causing 1 in 3 deaths in women each year. Cardiovascular disease kills more women than all forms of cancer combined. Well, there are major modifiable risk factors. These are, as was shown before by Brianna, high blood pressure, high cholesterol, the bad cholesterol, LDL, diabetes, excess weight, and above all, just an unhealthy diet. A good diet is fundamental to the treatment of blood pressure, cholesterol, diabetes, and excess weight. Other modifiable risk factors are smoking, avoiding excess alcohol, and as I'll emphasize later, physical inactivity. And we all know what a good diet is in terms of the heart. One based in vegetables and fruit and non-fat dairy. And we know what a bad diet is, one that's high in meats, particularly red meat, high-fat foods, and sugary drinks. The EPIC study showed that people who eat meat, their average cholesterol is significantly higher than people who do not eat red meat, even people who eat fish. And the cholesterol is clearly lower in large groups of people who are vegetarians or vegans. So what about vegetarian diets? This is a study of actually combining 13 studies, 844,000 healthy adults, healthy at baseline, but then during follow-up, 115,000 of them developed cardiovascular disease. And even after correcting for the other risk factors that we talked about, the results are similar in men and women. Eating a vegetarian diet produces, in this study, a 21% reduction in ischemic heart disease and heart attacks. And it's clearly shown then as well that an emphasis on vegetarian types of food, even if it's not a full vegetarian diet only, produces a general decrease in heart attacks and stroke. And this comes from the American Heart Association, emphasizing the importance of vegetables, fruit, whole grains, low-fat dairy, and lesser amounts of meat. An important thing to notice, though, on this slide is that the quantity of food that's emphasized here is just as important as the type of food. The American diet is including too large of an amount of food for portions, and all you have to do is go to a restaurant to observe that routinely. What happens when you eat a large dinner in the evening? Unless you then exercise vigorously after dinner, you don't burn off the calories. And the American Heart Association, in its publication, has recommended higher intake of fruit at lunch, higher intake of vegetables and non-fat dairy products in the evening. These, in a study, were clearly shown to lower mortality overall, as well as specifically cardiovascular disease or cancer. On the other hand, higher intake of refined grains, cheese, added sugar, cured meats, and high intake of potato and starchy foods after main meals were associated with greater cardiovascular disease and all-cause death. But I think the most important point of all this is that we have really failed to accomplish this in our children. And what you see in this graph is between 1963 and 2018, there's been a dramatic increase in obesity in children and in adolescents in the United States. The other largest factor is high blood pressure. 59 million women in the United States have high blood pressure or are taking blood pressure medication. And fewer than 1 in 4 women in the United States with high blood pressure have their condition under control. So regular medical care, having a blood pressure cuff if you have high blood pressure so you can check it yourself routinely, very important. But the other severely neglected way of preventing heart disease is exercise. And this is a study of 1.5 million participants who were followed in 44 combined studies. And what you see with this red star, this is corresponding to 150 minutes per week of moderate exercise, moderate walking, for example. And this is the minimum that the American Heart Association recommends. It produces about a 10% decrease in cardiovascular deaths. But look what happens if you make exercise part of your routine. If you make the time for 1 hour of moderate exercise per day, weekly, or a half hour of vigorous exercise, running every day for a week. Now we're talking about a 35% reduction in heart disease. That's a major factor. So in the last few minutes, I just want to touch on a couple of points that are specific to women in terms of heart disease. So frequently women who come to us who are having typical heart pain and find their way to the heart catheterization lab, why do some women with typical chest pain more often than men have normal coronary arteries at catheterization, and then there's no treatment specifically? So some women with typical heart pain but no blocked areas visible at catheterization have abnormal small arteries beyond the large arteries seen on an angiogram. This is referred to as microvascular disease. So microvascular disease is associated with the same risk factors: female gender, more commonly the male, obesity, high blood pressure, high bad LDL cholesterol. And the treatment is diet, blood pressure control, control of diabetes if it's present. And medications are available, but the outcomes in women with microvascular disease are no better than in men with large blocked arteries. There's another factor that I want to mention. What about women who develop coronary disease without any preventable risk factors? So let me mention a patient who I know well, a 70-year-old woman presented with new onset of very typical heart pain. She had no preventable risk factors. She did, however, have a family history of heart attacks in both parents in their 60s and in a sibling. She went on to have a heart catheterization. She had very advanced disease and had a coronary stent. So what went wrong? Why did this patient have a heart attack? Her lipoprotein small a level was 4 times the upper limits of normal. And some of you may not have ever even heard of a lipoprotein small a level. It is like the LDL or bad cholesterol. It is a form of cholesterol, but it is more dangerous. It sticks to the blood vessel walls. It causes inflammation. It causes plaques that cause heart attacks. And the American Heart Association, in its new guidelines, now recommend that everyone have a lipoprotein small a level once during their lifetime. It's a blood test. The point is that people who have this genetic risk factor should be identified at a young age and treated vigorously with diet and cholesterol-lowering medication. Fortunately, drugs are in clinical trials that, when available, probably will take 5 years, will lower lipoprotein small a levels. The point is, though, that we have to identify individuals who have high-risk families and test them early. So in summary, only you can prevent heart attacks by treating cardiac risk factors, by seeing the doctor and having them rechecked, by pursuing a heart-healthy diet all the time, by taking small meal portions, very importantly, by maintaining a healthy weight, and making time for yourself for exercise. It was mentioned earlier how women are often the caretakers. They devote more of their time to children and later on to taking care of elders. But it's essential to make the time to exercise daily. And while it's true that medications for heart disease are effective and invasive and surgical treatments for blocked coronary arteries do work, prevention is always better. I'd be happy to answer any questions.
Thank you so much. That was so informative. I knew nothing about lipoprotein small a levels. I wrote it down. So I think we got a lot out of that. I really appreciate it. And if there are any questions, feel free to put them in the chat.
Well, I think the tip-off from lipoprotein small a is if you have a family history that's very strong, this is something that you can look at throughout your family. You can look in your children, grandchildren, and you can, it gives you the opportunity to identify the problem early and emphasize the importance of diet and exercise, and if necessary, start medication. And this applies to children and adolescents as well.
Okay. Thank you. There, perfect. Okay. So, Dr. Harris, oh, I think I might see something in the chat here. Let's see.
And that's actually me typing in a question in the chat, but
And Dana typed in something as well. Does the
Okay.
lipoprotein check require a separate blood test in addition to LDL and HDL? Dr. Gerson, did you hear that?
Yes.
question? Yeah.
So, yes, it does require a different blood test. I think in the future may become part of the routine panel, but for the time being, you notice that the Heart Association recommended doing it one time during a person's life. It's currently a send-out test. It doesn't come back as quickly as the routine cholesterol and other lipids, but it is widely available.
And Yvette, Dr. Harris wants to know, is there a certain age to begin testing for the protein? But you were saying even children can have that test
It's-
done?
Yes, it's genetic. I would say, consult your family doctor, but from my standpoint, if you identify why there's a high risk in your family of heart disease, it's worth trying to find out why. And if it's not obvious that the standard modifiable risk factors have not been taken seriously enough by your family members, and that's why there's heart disease. If there's a lot of heart disease in your family, finding out if lipoprotein little a is present, I think this helps us to steer towards much more vigorous approaches in taking care of our children, adolescents, and young adults.
Thank you. Dr. Harris, can you talk, so you mentioned that your journey to a heart healthy life was through yoga, in part at least.
Through yoga.
Uh,
I started yoga seriously in 2019, probably when I was at my heaviest weight, and I think I was hitting the scale at 220 at that time. But I made some choices based on feedback from my primary care physician and my own sense of well-being to make some changes. And it wasn't that I did not exercise. I always exercise. I was doing step aerobic, but I was also doing the things that Ms. McNeil and Dr. Gershon talked a little bit about of the fast foods. My three favorite places in Oxford were KFC, Fonchens, and SDS. To the point that my mother was, and I'll get to the breathing in just a few minutes, but to the point that my mother was up one time and we stopped by KFC and I decided I was going to be on a diet that day. And so the person who was serving us looks at me and goes, "You're not," my mother ordered, and then I didn't order anything. And the person looking at us goes, "So you're not going to get anything today?" So out of all the people that come through that drive-through, she remembered me. And my mother goes, "That's a shame." And I felt shamed. But not enough to stop until I got a real wake-up call. So I launched into yoga just as a practitioner, and that was in 2019. One of the wonderful things that yoga has done for me is it's allowed me to make a better mind-body connection. So I pay attention to hunger cues and as a result, and some significant dietary changes as Ms. McNeil and Dr. Gershon have suggested to bring me down to my present weight. I'm not done yet, but it's better than up in the 220s. I actually participated in yoga teacher training last year. So I started in 2023 and finished in last summer of 2024. And I trained with Jessica Lowry from the Oxford Community Yoga Center. So I am a certified yoga instructor. I'm trained in the Hatha yoga tradition, which combines breath and postures. And I think that Hatha yoga is just so phenomenal if we're thinking about using yoga as a stress reduction. You can use yoga for anything you want to use it for. If you want to get lean and trim and toned, you use yoga for that. But for me, it was using yoga for stress reduction. There are 8 limbs to yoga. Do not ask me about the 8 limbs, but I will tell you 2 limbs that we're going to go through this evening. And those are pranayama, that's Sanskrit for breathing, and asanas, and that's Sanskrit for postures. I will tell you, there's no perfect yoga body. You can do yoga for 5 minutes, you can do it for 60 minutes, you can do it for 90 minutes. The idea is to combine movement with breathing. If we talk about changing lifestyle. So let's say that you've changed your diet and you've added some exercise in. And let's say that you're not quite ready to go run that marathon, but maybe you need to coordinate your breathing. And yoga is one way to bring your stress down. Yoga helps regulate that fight or flight system, you know, when we're that parasympathetic, sympathetic nervous system that are communicating and talking to one another. And sometimes we as women get stuck in this fight or flight system. It's certainly not good for your cardiovascular system. So how do you work on that? So you're working on lifestyle changes, you're medically managing your disease. You know what you can do? You can breathe. So I want to take us through. So if you're in a noisy environment, if you can kind of get it quiet, you know, kind of cut the TV down a little bit or the radio down. But I want to take us through something that I have found so effective, and it's called three-part breathing. Pranayama is so important. We take breathing for granted, but I have found that it is an effective way, if my heart rate is racing, to bring my heart rate down. So what I'd like you to do is to get in a comfortable position in your chair, as comfortable as you possibly can. And I'd like you to close your eyes. And I'd like you just to let the body breathe itself. And when I say just let the body breathe itself, I mean just pay attention to your own breathing. And watch the rise and fall. Internally, your eyes are still closed. At least feel the rise and fall of your chest. And just let the body breathe itself. In yoga, there's a type of breathing called Ujjayi breathing. And that's when your breathing sounds just like the ocean waves. And I'll try to demonstrate it. And if your body calls you to engage in Ujjayi breathing, just begin to do that. But let the body breathe itself. And if you're feeling that your body is tense because we received some powerful information today, just let your body kind of melt into your chair. And let the body breathe itself. Place your hands on your bellies. And feel the rise and fall of your belly as you inhale and you exhale. Inhale and exhale. Inhale for a count of 3, 2, 1, and exhale. And let the body breathe itself. Bring your hands to your rib cage. And just feel the movement of your rib cage as your body breathes. And inhale and exhale. Inhale and exhale. Inhale for a count of 2, 3, 1, and exhale. Place your hands back in your laps, palms down, and let the body breathe itself. Bring your hands to your chest and just feel the rise and fall of your chest. And let the body breathe itself. Inhale and hold. 3, 2, 1. And release. Bring your hands back down on your thighs, palms face down, and just lower your head as if you're lowering your chin to your chest, and just let the body breathe itself. Slowly lift your head, flutter your eyes open. If possible, bring your hands above your head. Clasp your hands together. Bring them to heart center. And just let your body breathe. May all living beings know peace, joy, and freedom from suffering. Jai Bhagwan. That's a 5-minute technique that you can do in the morning, anytime you feel stressed. And I tell you, it works for me. I'm hard, I'm difficult, but this one works for me. So thank you, Amber. Thank you, Geneva, for just allowing me to take you through a small practice. It's pranayama Sanskrit.
Thank you. And there's a question for you, Yvette. Explain the word namaste.
Namaste is it's an ending kind of phrase in yoga, and we typically in Hatha yoga don't use it, but it's just the light in me sees and honors the light in you. And so typically who uses that term? It's typically people who are renunciates as opposed to practitioners. Renunciates are people who live yoga day by day by day by day, and they've gone off, something like monks. But I, as a practitioner trained in the Hatha yoga tradition, say this more Sanskrit ending, and that's the light in me. I mean, not the light in me. May all living beings know joy and peace and happiness and freedom from suffering. I'm not a renunciate. I'm just a person who lives in the world who practices yoga, which most of us do. But it's the light in me sees and honors the light in you.
And I want to honor the light in everyone who came and who shared. Thank you all, Ms. Brianna McNeil, Dr. Gerson, Takia, thank you so much. And I do want to remind you, and we're gonna see a little art soon also, but part of this is a fundraiser. So the flyer that you were sent that you used to register, I donated today, and I mentioned you, Takia, and thanked you for being a woman of impact in my comment, in my donation. But please take some time. No, thank you for sharing that. No amount is too small. But whatever you feel, um, you know, moved to give. And then also share this link in the flyer with people in your life who are willing to donate as well. No amount is too small or too big. I'll add that as well. Now, Maggie, you've been here drawing. Are you in a position to be able to share at least part of what you've created?
I will try. I'm not sure if I can do that.
Yeah, if not,
It will be available afterwards for everyone.
afterward, yes,
Yes.
yes, absolutely. Oh, wait, oh, wow. I can't, Jen, was that something that can you talk about what you just shared? That's great.
A colorful reminder to go for a walk.
Wonderful. Thanks for sharing. Yeah, I think because of the background, it's hard, but you wait till you see it, everyone. She makes the most amazing pieces of art out of the Zoom sessions that she attends. And so we'll make sure that you all get that. Maggie, it's hard for us to see it, but we'll have you send it to Geneva and she'll share it with everyone.
I will do.
Okay.
Honored to be here.
Yes, thank you for saying yes. And we have some thank yous. Okay, Geneva, you're welcome, everyone. Thank you for joining and have a wonderful, wonderful day and practice heart health. Do the smallest next step that you can to take that journey toward a healthy heart. Bye, everyone. Thank you for sharing, Penny.
Thank you, Amber. Thank you, everyone.
Bye.
Thank you. Bye.
Myron, thank you so much.
Thank you, Amber. It was a terrific program.
Oh yeah, I really enjoyed it and learned something, which is always a win-win. So, okay, I'll end the